Chest pain. Watch this 5-minute video to learn about the common causes of chest pain. Chest pain appears in many forms, from a stabbing sensation to a dull ache, and sometimes it may feel like it's crushing or burning you. In some cases, the pain travels up the neck and into the jaw, and then spreads to the upper back or down one or both arms. This is what we call radiating pain. It starts in the chest, but then it radiates to other parts of the body. Many conditions can cause chest pain, but the most life-threatening causes will involve the heart or the lungs. Because this is a serious issue, it's important to seek immediate medical help. Now let's get into the causes. Firstly, there are heart-related causes. Examples of heart-related chest pain include angina. This is chest pain caused by poor blood flow to the heart. This is often caused by the buildup of thick plaques on the inner walls of the coronary arteries, the blood vessels that carry blood to the heart muscle. These plaques narrow the arteries and reduce the heart's own blood supply, especially noticeable during physical activity. Heart attack. A heart attack, or myocardial infarction, results from blocked blood flow to the heart muscle, often from a blood clot inside one of the coronary arteries, which then leads to death of heart muscle. Many people describe the pain of a heart attack as the worst pain they ever felt in their life. However, if you are an uncontrolled diabetic with nerve damage, you may not feel the pain of a heart attack, but this does not make it any less serious. Aortic dissection. This is a life-threatening condition that involves the main artery leading from the heart, called the aorta. If the inner layers of this blood vessel separate and blood is forced between the layers and can cause the aorta to rupture. If this vessel ruptures, there will be a lot of internal bleeding and a rapid fall in your blood pressure, leading to death. High blood pressure and atherosclerosis are risk factors for this condition. Pericarditis. There is a sac that encases the heart, and when it is inflamed, it is called pericarditis. This condition usually causes sharp pain that gets worse when you inhale or lie down. Rheumatoid arthritis or a viral infection can cause pericarditis. Now we come to lung-related causes. Many lung problems can cause chest pain, including a blood clot in the lung, also called a pulmonary embolism. A small piece of blood clot that breaks off from a larger clot in the leg can get stuck in a lung artery, which can block blood flow to lung tissue. The chest pain is similar to that of getting a heart attack. Inflammation of the membrane covering the lungs, which is called pleurisy, causes chest pain that gets worse when you breathe in or cough. This can be caused by a viral, bacterial, or fungal infection. Rheumatoid arthritis can also cause pleurisy, a collapsed lung. Chest pain that is caused by a collapsed lung typically begins suddenly. It can last for hours. It usually causes shortness of breath. This occurs when air leaks into the space between the lung and the ribs. A fractured rib can lead to a collapsed lung. High blood pressure in the lung arteries, called pulmonary hypertension, is another cause of chest pain. This condition affects the arteries carrying blood to the lungs. Pulmonary hypertension can be caused by left-sided heart failure, sleep apnea, and kidney disease. Now let's talk about issues with your digestive system that can cause chest pain. Heartburn or acid reflux. This is a painful, burning feeling behind the breastbone or sternum. It occurs when stomach acid washes up from the stomach into the tube that connects the throat to the stomach. That tube is called the esophagus. When stomach acid burns the esophagus, this can lead to chest pain. Swallowing disorders. Problems with the esophagus can make swallowing difficult and painful, and you can feel that pain in the chest. Gallbladder or pancreas problems. Gallstones or inflammation of the gallbladder or pancreas can cause stomach pain that spreads to the chest. Note that diabetes increases your risk for gallstones, and heavy alcohol use can lead to an inflamed pancreas. Now, let's talk about chest pain due to muscle and bone issues. Costochondritis. In this condition, the cartilage of the rib cage that joins the ribs to the breastbone becomes inflamed and painful. This can be caused by severe and chronic coughing or an intense chest workout at the gym. Fibromyalgia. Fibromyalgia is a disorder defined by widespread musculoskeletal pain, accompanied by fatigue, sleep, memory, and mood issues, and it may cause long-term pain that affects the chest muscles. Injured ribs. A bruised or broken rib due to trauma can cause chest pain. Finally, we have miscellaneous causes of chest pain. Panic attacks. If you have periods of intense fear with chest pain, you may be having a panic attack. Panic attack symptoms also include a rapid heartbeat, rapid breathing, a lot of sweating, shortness of breath, nausea, dizziness, and a fear of dying. It can be hard to tell the difference between a heart attack and a panic attack. Always seek medical help if you aren't sure of the cause of chest pain. Shingles. This condition can cause intense pain and a band of blisters from the back around to the chest area. The pain can manifest on the chest wall before the rash is actually seen. Call or WhatsApp us today at 7475-297 or 3083370. We are located at number 4 Chincuna Gardens, Chin Chin Road, Cunupia. If you need immediate help, you can call the ambulance at 811.
You can tap the description below for all of our contact information.